To be an effective, successful caregiver, you need to have an understanding of the differences among those from other cultures. Knowing the important cultural differences with your elders is an essential skill for all caregivers. The fact is, the face of the U.S. population is changing. Minorities now make up about 35% of the U.S. population, but by 2050, minorities will be the majority. A major reason for this is that the birth rates for whites is declining, but it's increasing for minority families. And these changes are already having an impact on your caregiving. Why? There are important differences among the cultures that can have a significant impact on the way you deliver caregiving to them. Your elders from different cultures will require different types of care from you. Different cultures can have big differences in medical beliefs and relationships. These different beliefs include disease treatment, how or if pain is expressed, family involvement, relationships and communications, approaches to dying and death. These differences, and there are many more, can have a major impact on how you successfully deliver care to those from other cultures. And there are differences in personal relationships that can also impact your caregiving. For example, in some cultures, direct eye contact is avoided, standing too close is undesirable, standing close and hugging is desired, thumbs up or okay sign can be an insult, crossing legs to expose sole of foot is disrespectful. These are just a few examples of cultural differences that can have a direct impact on the daily care of your elders. And there are family involvement differences as well. In some cultures, there's major family involvement in medical care. When caregiving for these cultures, you need to be prepared for family members to be heavily involved in caregiving decisions involving their elders. And there are personal caregiving differences as well. Caregiving cultural differences that you need to know about include modesty issues involving caregivers of the opposite sex, restrictions on touching by the opposite sex, modesty requirements for bathing and toileting, and special clothing needs. These are just a few of the cultural differences that can have an impact on your caregiving that you need to be aware of. There can be many different ways that different cultures deal with dying and death, and you need to be informed so you can give skilled care at this very difficult time. What can you do about all this? It's simple. Ask questions. If unsure, always ask questions. Check with family members. Ask fellow caregivers. Ask the clergy. Perhaps even ask the patient or elder. The point here is, you do not want to proceed with caregiving with residents from other cultures if you're uncertain about how to approach them. And there are laws about all this too. Laws and guidelines require certain standards in caregiving for those from other cultures. In fact, there are both federal and state laws regarding this. Some of these laws include: patients must receive health care that is respectful of their cultural beliefs and practices. Language assistance must be made available. Your institution must provide ongoing cultural education to the staff. You cannot discriminate in any way. There's much more to all this, but the bottom line is simply this: you need to become educated on these cultural differences, and you need to get your information from family members, other staffers, local library, the internet, cultural centers, and cultural competency training in your institution. In order to be an effective caregiver, you need to learn all you can about how to give excellent caregiving for these elders. It's called culturally aware caregiving, and it's the excellent caregiving of the future.